Hello everyone. Thank you for joining me tonight, and let's start. Hi everyone. It's Midwife Cath. Hope you're all doing well, and really looking forward to answering your questions. I've got heaps here, so I hope to get through to them all. Waving to everyone. Hi guys. It's so good to be able to do this, especially in isolation time. Who would have thought we're going to have a pandemic? So anyway, hope I can help you. And there's a few things that I'll tell you. There's three things that I really like to sort of say you need to win as a parent. One of them is sleep. There are easy ways to get your babies to sleep. There's not tough stuff. It's just some really kind, loving attention. The other thing is behaviour. A lot of it, all of it comes from us. So we've got to teach our babies how to do things. The other thing is about food. And it starts with the milk and then introducing food after 6 months. So there are lots of things that I'm really interested in and will help you down the track. Just by the by, for my Marquise baby, there's a 20% off. So if you go to the website, there'll be, and just put in Midwife Cath as the code, okay? All right, so we've got lots of people here, and I will start, because I've got a heap of questions, so I have to read them, so I'm going to look up and down to read the questions. So the first one's from Kate. And Kate is saying her son is 6 weeks old and she has breast implants, which, not everyone totally lactates that well with breast implants. Some you'll definitely lactate, but maybe not enough to maintain the lactation all the time. So Kate's saying that her little bub is crying off and on the breast. And it's quite a common thing to happen, Kate. So what the best thing to do is not try to keep trying to get the baby back on. So because we get quite tense, trying to force the baby to feed. First of all, I like to wrap babies for feeding because it makes them nice and calm and safe and feel close to you. And if the baby's fighting or fussing or, not sort of sucking that well, take the baby off. Do a little tummy time, back time, change the nappy, start again, reset, both of you. Because if you're trying to fight each other, it doesn't work. Then babies learn that when they're going to the breast, they're going to start to fuss. So Kate, a little bit of tummy time, take a deep breath. I'm right into breathing. Right, a deep breath and hope that helps. Okay, now, I haven't got a name for this lady, but she said her 5-month-old cat naps all the time. She's tried everything to get him to sleep longer. Okay, this is I love talking about sleep, especially during the day for babies. Now, babies need a lot of sleep, obviously, but not all babies sleep all day and all night. They just can't, because if they did, they wouldn't be that well if they did. So 5 months old, if the baby's rolling, I like to think that if the baby's moving, having lots to drink, they'll have probably 3 or 4 little 40-minute naps. That's okay. It's not until the baby's very active on the floor, like really rolling well, crawling well, very inquisitive, and then that reflects in the sleep. So we've got to have that balance. I always talk about a balance, and that is how the baby's moving, how the baby's sleeping. So the activity reflects the sleep. The sleep reflects the activity. So try not to sit them. Don't put them in, containers, as I call them. Don't put them in those things that they just sit and do nothing. Get the baby moving. Give them freedom of the floor. And when they've got freedom, what they do is they move a lot. They use the energy. They drink some more. They move a lot. So you do feed, play, maybe you sleep then. You've got to nail overnight first. That's the sleep you want to do. Daytime, that comes. Be patient. Okay, Molly is saying her baby is 8 months old and doing some teeth grinding. Very normal, Molly. It will go. It will go. It's some babies do it, some babies don't. But if they do it, it's okay. Nothing. There's no problem. Thiani says my newborn does a cry in the middle of the night, even after being fed, and sometimes stay awake after being fed. So a little newborn baby, look, we have great expectations on babies, and there's so much pressure on mums and partners to have their babies sleeping all night. And, the babies can't sleep all night when they're new because they've got to have a lot to drink. They need all that energy to grow. Their brain grows so fast and needs lots of food. So again, be patient. Just feed the baby. I like to say to respond to the baby. And when you respond to the baby, you're actually going to what the baby needs. Hope that helps. Claire, when should I ask for an epidural? Okay, good question, Claire. I've looked after lots of women in my 40 years. Well, I've been nursing for 45 years, but my midwifery career has been 40 years. An epidural, I've looked after women who've had an epidural before they've been induced or they're 1 centimetre. It's up to you. If you're feeling like you need an epidural, ask for it. It's okay. Never too early. Can be a bit late, so never too early. Claire. Emma, what are my thoughts on SNU? To be completely honest, I actually haven't seen one, but I don't know, so I can't comment. Sorry about that. Lauren, can an epidural make you lose feeling in your legs long term? Well, I hope not. No, I hope not. It can, obviously, because you're having an epidural into your back, so the potential is that there can be damage, but I've never seen it myself. And there's a lot of horror stories, isn't there, that a lot of people talk about, but it's pretty rare. Don't worry too much, but the doctors these days, the anaesthetists, are amazing how they do the epidurals. Okay, Danielle. Oh, got a long question here. Sit back. Have a 9-month-old. Willow isn't interested in the dummy, but she does suck a thumb. That's okay. Let her suck a thumb. That's okay. The dummy, not all babies want to take it. So the other thing, nappy changes are a nightmare. I totally understand that. They're like a wriggly, and you really have to control them because they're over on this side, they're over this side, the legs are up. So you can do a few things. You need to pull things from, behind you, something that makes a noise, something that she hasn't seen, and give it to her and then quickly change the nappy. The other thing to do is to sit the little bub on your lap and change her from the front. You get very inventive when you're a mum, especially when you're trying to change a nappy for a new baby. Well, sorry, not a new baby, but a 9-month-old. They're quite strong and they wriggle quite a lot. It's very difficult. Laura has a 2-week-old. Oh, Laura, hope you're doing well. And very unsettled between 8 p.m. and 3 a.m. It's pretty normal, Lauren. Wanting to feed lots, yep, and unsettled in between. At times has started as early as 4 p.m. Okay, so as everyone knows, I do a lot of feeding and then unwrap the baby, tummy time, back time, rewrap the baby, more feeding. So unsettled, it's an interesting term because so many people will say to you with a new baby, is the baby settling or is it unsettling? And really, a lot of the time as mums, you don't know what it is. So as long as the baby's gaining weight and having lots of wee, it's important that you've had the baby checked and make sure that everything is okay. But that time between like 6 and 7 o'clock at night till midnight is really a very hard time because babies just want to feed all the time. And that's when I like to encourage you to feed them. I also do a deep warm bath at about 10 o'clock, and that can help also with the baby, Laura. So give that a go. So I do the bath at 10 o'clock, really deep and really warm. So make sure that it's nice and warm so the baby can relax, and then rewrap the baby and give some breast, and then unwrap, tummy time, back time. All of that is a really good combination. Good question though. Marianne is saying, how long should a newborn be awake? Well, that's, how long's a piece of string? It really depends on every baby. It depends on how many weeks they were when they were born, their weight, your breast milk supply, how that's going, whether you've had one or two babies. It's not because the second baby's more settled. It's because we know what to do. So there's a lot of answers to that. So, but a baby will go to sleep when they're full and comfortable. It's also good to keep your baby close, and that is to hold the baby as much as you can, keep the baby close, feeding, tummy time, back time, and they don't have to go to bed to be asleep during the day, to sleep during the day. You can actually hold the baby. Nothing's going to happen if you love your baby. You can't overlove them like you can't overfeed them. So it's good to be able to just relax and enjoy. There's so much stress around feeding and making sure everything's perfect. And as long as your baby is well, that means it's not sick. If your baby's well, gaining weight, drinking well, you'll get there. And everything happens within time. Like things settle down. The first 6 weeks are pretty tough. And then the first 3 months, I usually say put a circle around 3 months, because that's when babies tend to just have a really nice settle down and start to feed and sleep well. Marianne's got a few questions here too. How does she increase her milk supply? You increase your milk supply by having the baby suck on you as long as you can. So it's a supply and demand. So what your baby wants, you get. So you really need to just keep the baby on the breast, do some tummy time, back time, change the nappy, rewrap, back on the breast. I know I've said that 100 times already, but that's why it works. You've got to just do some really common sense stuff, hold the baby, feed the baby, tummy time. The other thing, ladies, is keep your baby dressed. And I know in a lot of the hospitals, they tend to say undress the baby to feed. I sort of like the babies to be dressed and just wrapped for some time. And, it's like think about what you're doing when you eat. You like to be dressed and feeling comfortable. So do babies. And babies can get cold. Now, it's just really important to keep them nice and close too. Okay. And when is it the best time to pump milk, Marianne says? Look, often the best time is usually first thing in the morning, or that first 3 or 4 hours in the morning. I mean, you can pump at any time, of course, but after a good sleep, well, not as though everyone sleeps very well with a new baby, but if you've been in bed and the lights are off, that's what our brain does. That's how you wake up and you feel really nice and full. So after you've fed the baby, you can do some pumping then. Okay, well, someone with hasn't got the name to it. 6-month-old is feeding 3 to 4 times a night. She tried passive settling but wakes up 45 minutes later. How many times does she need to be fed overnight? She's on 2 solids a day. She's 7 kilos. 6 months and 7.5 kilos. She doesn't really need to have the 2 feeds, but it's okay if you do. Like, It's not a crime that you're feeding your baby. It's fine. It's about what I think about is how you are doing as mums and and partners. But the mums, we carry a lot of the feeding and the parenting as far as getting up overnight. So I really would say that I'd stick to the passive settling. Maybe give a bit of a week in between and start again. Stick to the rules in my book and should work. Okay, Alex is saying, if your baby falls asleep while breastfeeding, can you put them straight in their cot or sleep, or do they need to be? Yes, you can. But I'm very into holding and giving the baby some cuddle time, and also just some relaxation time for you, holding the baby where there's no rushing. And I think that's what Mother Nature does, gives us that lovely gift of time when we're breastfeeding our babies, because they can be time wasters, but it's lovely that you can actually sit down and feed and just stay still for a while. In this crazy, crazy world, it's really nice to be able to do that. How's everyone going? Everyone still awake? Everyone there? Yes, that's good. Okay. Alex. Oh no, I just said Alex. Natalie, do we really need to watch awake times? Like so many sleep school says, 8.5-month-old baby has always stayed up longer. Yeah, no, it doesn't matter as long as they're sleeping overnight and they're doing well. No, I'm not very strict on that at all. I just, as long as you're happy, hi guys, it's really important that, like, they're only a baby for a little time. They're an adult for a long, long time. And we don't have to be regimented and put them into bed and put them into a cot and then sit there and go, you've got to go to bed. Just love your babies and have a lovely time. Because it can be tough, but I'm on your side, really am. Okay, Carly says baby is 5 weeks old. Oh, we've got some little bubbies tonight, and you've got engorgement in one breast. Ouch. Yeah. It gets hot in a few small lumps. Okay. Look, one thing, Carly, just don't really massage those lumps too hard. You can just gentle massage, not too hard. Look, I think maybe feed from that side first, and then unwrap the baby, tummy time, back time, and then put on the other side. If you've got any pain in your breast, you really need to see someone face to face so they can check you. Just hoping that everything's okay. They're doing my bath bottle in bed and coming home from hospital. It's working really well. That's fantastic. Finding she's sleeping from around 8 and 9, and we need to wake her for the bath. She doesn't do a very long stretch. Okay. Yes, you can. How old's the baby? 5 weeks old. So you can bring the bath forward. Yeah, I would, maybe an hour, just an hour, and bath her a little bit earlier. You can still wake them up and bath for the night. That's okay too. Bethany, she's about to have her first baby. Oh, good luck. Hope it all goes well. It's life-changing, absolutely life-changing having your baby. And it's just amazing when you see your baby for the first time. It's something that you quite never forget. Currently reading my book. Oh, you wanted me to do Cat's Wrap? Look, I would love to, but I can't do it here tonight. I'm so sorry. Look, I think it's on YouTube. I'm pretty sure it's on YouTube. So have a look at it, and it works very well. And get some really nice big Muslim wraps so that they're nice and light too. And just good luck. Enjoy your first baby. How gorgeous. Chloe, and we're just about to start passive settling with our 8-month-old second time around. It did work, but then we got a bit lazy. I understand. Yeah. Thanks. It is, it's on slow motion, is it? Someone says it's on YouTube in slow motion. Okay. I think I better make another one soon, and I'll put it on YouTube. Okay, Chloe, however, she's almost outgrown a bassinet. We'll think you're putting her to sleep in a cot when you, yep, okay. So when you start the passive settling, you start passive settling for the first sleep at night. So like 7 o'clock at night. I would put her in the new room, start the passive settling that night, first in the new room, or else there's too many changes in the cot. Good luck. Hope it goes well. Okay. Thu, my 3-month-old has 6 breast milk bottles a day. Offer a bottle every 2.5, 3 hours. He has started to sleep through the night. Well, that's great. It makes 6 feeds hard to squeeze. Okay, you don't have to do 6 feeds, but so as long as the baby is growing and weeing, putting on weight, you can always do it before the baby's going to bed at 8 o'clock. You can always do a dream feed at 10 o'clock. That will get your sixth, it's a bit of a tongue twister. That will get your 6th feed in. Oh, get my teeth in. Jess, my 3-month-old naps 5 to 6 hours a day between 6 and 7. Is this too much? No. Can you wean night feeds in the 3.5-month-old who is on the 99th percentile? Well, yes, you can, but if the baby's waking, Jess, I'd still feed. The baby's only 3 months old, so 3 months is still only a little bubby, and they need all their food. That's okay, Chloe. My pleasure, love. Link here. Okay, we followed the BBB for first daughter, who's now 2. She's due to become a big sister. Well done. All the best. And the question is, do we still do a 10 p.m. bath for the newborn? Absolutely. Absolutely. So you put your 2-year-old to bed first, and then you go, wow, that's great. And then you just do some feed, play, right up until the 10 o'clock bath with your newborn baby. All the best. That's it's a very exciting time, and it's a lot of work, but you know what? It's beautiful. It's great to do. Kate, another Kate. What are the best tips for settling a baby that rolls onto its front, then awakes, almost in fright to find he's on his front? Yeah, I understand that. Look, in that situation, maybe just reassure him if he's rolling on his tummy during the day, rolling really well. That's really helpful. But if the baby, so why is crying when he rolls on his tummy? You got to make sure that he's not in any discomfort, and he will settle. It takes time. Also, just do lots of tummy time during the day so he knows what to do, and that tummy time's okay, because babies, once they actually get in their cot and they're over 6 months and they're rolling, they do roll over, and they can sleep on their tummy. The 5-month-old makes a grizzle groaning sound all day. Normal, not upset, more practice sounds. Yeah, they just talk away. It's about learning to talk. Any back-saving tips of how to settle a baby at night as leaning over to the cot to pat him? Don't do that. It's not good for anyone, bending over the cot and patting. It's not good for the baby. It's not good for you. Get the baby up, and depends how much the baby weighs. I can't sort of answer this, to the T, because I don't know how much the baby weighs, but just try not to get into that leaning over and patting. Hold your baby. They're only little. 5 months is still very little. We do expect a lot from them. Dan, oh no, I've done that, sorry. Okay. Charlie, what can you put on drool rash? Comes up since starting solids. Okay, so you just got to keep it clean and dry. There's not much that you want to put on the face. If it gets too angry, I would go and have a check with the doctor, and they might order you some cream. But I can picture exactly what it's like, and you're probably best to have it checked. Have a look, get the maternal and child health or your doctor to have a look at. Parry. I have a new bowel and 6 weeks old that won't sleep more than 45 minutes during the day. Yep, that's right. That won't need a lot of resettling once she wakes up. Well, don't worry about resettling. So daytime, you want to do lots of feeding. Feeding, play, feeding, play, feeding, play. Just do that, because you can't just feed a baby and then expect them to go to sleep. Because it's like us, if we sat in the chair all day in isolation and we didn't have a walk or some exercise, it's very hard to sleep at night. So it's the same with babies. They've got to have a balance of the calories in and the energy out. Really important. So try a bit more tummy time. Juanita, if it's not too late, a successful method of settling a baby after a feed that doesn't involve him in bed. Okay. Oh, in your bed. Yeah, no, you don't need the baby in your bed. So again, with babies under 6 months old, what I do is the feed, play, and then, when they want to sleep, I always feed babies to sleep under 6 months. And then after 6 months, I do passive settling. It's not a crime to feed your baby to sleep. It's really okay. It's about love. And that's what breastfeeding's about. And that is what parenting's about. Loving your baby and keeping them close. And it's up to us to teach our babies everything, absolutely everything. So by doing some tummy time and back time, you're not trying to get the baby into this rigid routine. They just can't do it. Like some babies do, but the majority don't. So, relax, breathe, enjoy, just keep it calm. Petal, that's a nice name. I bottle feed my baby during the day and breastfeed overnight. My little boy starts sleeping through the night. Will my supply stop? Okay. As long as you're doing some breastfeeds during the day, that's what you need to keep up your stimulation during the day. Deb is saying, what can I do to ease my 4 weeks old gas? She wakes up crying from the pain. Okay. Oh, every day I talk about wind. That's all I do. It's sort of, I think it's because parents, grandparents, aunties, it's sort of a handed down thing. Every time a baby cries or pulls the legs up, everyone thinks that it's wind. Do you know what? It's quite normal for babies to do that, to bring their knees up and to squirm. Very normal. And it's not, they don't have gas. I'd actually feed the baby, because when you feed the baby, what babies have is that it's called the oral anal reflex. So the sucking of the oral stimulates the anus or the bottom to pass wind. So it's all about in the feeding. Good question though. Jojo, 3-month-old has started crying in the pram and walks. Oh my God, I can relate to that. It's not a hungry cry because we put her in after a big feed and around her usual nap time. Often she'll cry for a few minutes and go to sleep. Look, some babies just don't like being, flat down in the pram, and, try not to put the wrap over or anything over the pram. I think the people who know me know that I don't like that. I like the babies to get some fresh air, because as long as they're rugged up, they're not going to get too cold. Sometimes it's good just to pick the baby up, sit down, reassure, and then put the baby back down and start your walk, or sing. Talk to the baby. I used to sing. I used to sing The Sound of Music, the whole score. No, right through the walks. Everyone probably thought, well, here comes Maria von Trapp. Look, someone wants some breastfeeding tips before the baby arrives. Oh my goodness, I'll be here next week still telling you all about the tips. Mel, my 12-month-old needs to be patted to sleep. which is okay. It takes 10 minutes, but the past 2 nights it's taken close to 1.5 hours. Mel, don't do it, because this time next year you're still going to be patting the baby to sleep. The bubby's 12 months old. Try the passive settling that's in my book, and I'm sure it would work. Maybe could you shed some light on the day naps? Okay, so 12-month-old, normal routine is they're up usually like 6 o'clock in the morning, full of beans, up in the morning, breakfast, play, and try to get very active play during the morning, and then an early lunch at about 11:30. And then change nappy, a nice drink of milk, whether it's breast or from the cup, whatever, and then bed. Usually, a lot of babies have a 2 to 3 hours sleep at 12 months old. The other thing so at 12 months to 40 minutes, they sort of transition to the 1 sleep a day. And it lasts for 4 years. They do that, up all morning and then go to sleep. It's so nice to have that time for them and for you too. Amy, I breastfed my 4-week-old daughter in the football hold. Is that how she was shown in hospital to avoid her sitting on a C-section? Okay. She's starting to fuss around. Okay, bring her back. Football holds for footballers. Bring the baby in the cradle hold and wrap the baby, and that should help, Amy. Court, my 4.5-week-old baby boy sleeps a lot, mainly waking every 4 hours for feed. He's gaining weight and over his birth weight. Good. I'm worried he's sleeping too much. That's okay. As long as he's drinking and sleeping. And you also don't have to put him to bed during the day. You can leave him up, feed, have a little bit of a play on the mat, then feed again and play, and then have a sleep. You know what? I think I've done it. I've nearly got through I've got through all the questions. Now, what else was I going to start? I've said that you can't overfeed. Remember the 20% off from Marquise Baby, and the code is Midwife Cath. That's me. Thank you so much for... That's good, Jojo. Get your Sound of Music. I love the Sound of Music. Do you know what my parents did? I never saw the second half of Sound of Music till I was about 8. Isn't that gorgeous? My parents were so lovely. Anyway, I hope you're all okay, and look after yourself in this very difficult time and a pandemic, and take care. Lots of love. I'm always on Instagram, putting up some information for you, and I hope you've enjoyed tonight. I've really loved it, and thanks to Marquise for having me on their site. Look after yourselves, take care, and love your babies. It's all you need is love. That's what the Beatles said. Take care.